Broken plates and hardware can occur after foot and ankle surgery. However, we're seeing more and more of a trend in this direction as some of the hospital systems are requiring surgeons to use specific products for better contracts. Here's an example of one of the scenarios. You have a patient, older individual that has a severe osteoarthritis of the big toe, pain every time she walks. You can see the position is a little bit higher, which is causing some impingement of the joint. Very flat-footed bone spurs, which are not bothering her, and she is obese. So we agreed, let's fuse the joint. Fuse the joint. She's doing well after about 6 to 8 weeks, and came back to my clinic 6 months later, and here we are with a broken plate. Looking at my records again, and noticed that. I used a plate that the hospital has made me use for contracting purposes, and this is what happened. In scenarios like this, I'm kind of more proactive now to kind of go to certain hospital systems that allow me to use different cases or different hardware supplies that I've had better success with, that don't break and fuse the patient's joints. And this is the one benefit with private practitioners, is that we can kind of take our cases to each different hospital systems, and some hospitals are contracted, some aren't. So it kind of gives us the liberty of using what we want with very little change in cost to the patient. However, some W-2 doctors that are employed by hospital systems have no choice but to do the surgeries at their system and are forced to use the plates. And you can see in this scenario, I was kind of forced to use one plate, and several months later it broke. So it created a non-union, and you can see it's rubbing, potentially rubbing on the top of her shoe. So I'll be undergoing this revisional surgery in the next couple of weeks, and I'll post the results with the x-rays and some pictures. So stay tuned. Please follow my YouTube channel, and you'll see the before and afters of the patients and outcomes. Thanks.